Et, and welcome to week 3. This week we're going to go over infants, toddlers, preschoolers, so ages 0 to 5, that quick. And I'm going to give you those key growth and developmental areas that you need to understand, and ones that just the concepts more than numbers, like, heights, you don't have to understand as much as the weight of an infant. I think infants, the way they gain their weight is very important. And then when we're done with all of these PowerPoints today, we're going to go right into a Kahoots. And the Kahoots is like 55 questions, but it really covers those concepts that you're going to see on an exam, on your HESI, or on your NCLEX. And it's just reinforcement of things that I can't cover everything in a PowerPoint. And it's that making sure that it is covered. I put it in the Kahoots and I know that I'm not going to forget. Okay, so they're good Kahoots. I want to make sure that you do understand it is something you should review for when we get to exam. Now, this week you have quiz 1 due, and I'm glad that most of you waited till after class to do it, because there are some of your theorists there and understanding them. I'm going to try to get you through that tonight. And then, of course, discussion question 2. Last night you had the first part due, and then Saturdays by Sunday night at 11:59, you have the 2 peer responses. Now you can see that I did score last week's discussion questions. Be sure you write a reference. Make sure that you answer all of the question that I'm asking. Some people just told me why you wanted to be a nurse, but didn't tell me about nutrition. So making sure that you do answer the whole thing is very, very important. Make sure there's a reference there, written as best you can. And if you're having issues with writing things, always go to Purdue OWL. It's a site on the internet which is phenomenal with APA. Okay, it's a scholarly site, so it's a good site. And then forgetting to cite within the paragraph. So maybe you wrote 2 paragraphs and you wrote me a reference. Well, that information it's not what you knew, it's what you read in that reference. So you have to put in parentheses. And I've put those examples on those discussion questions as a comment after I graded them. So if you see with it in parentheses, it means I want it somewhere in the paragraph. And I will let you know every week what you're going with your APA, what you need to be improvement on. And again, if you need help, you have Purdue OWL, and then you have me. Just ask me. Come a little bit before class or stay a little bit after class, and I can help you with APA. Because most of you probably are going to go on for your BSN and maybe even your practitioners. And you're going to have to understand for your BSN APA, because they will be grading it a lot stricter than I am. I am an introduction to APA. I'm not going to hit and bang you hard on it. It's an introduction. As long as you have a reference and you're attempting to do that and you're writing in the right way, I'm going to accept it. As long as you're not cutting and pasting, don't do that. I can tell those words very easily that are not your words. So we are going to be going over the PowerPoint first, and then we're going to do the Kahoots. Last class, I got out about 1/4 till, so you will get out on time tonight. Any questions for anybody? Okay, let's go ahead. Simona, are you going to come on camera tonight? Brandy? There you are. Brandy, are you there?
I'm here, but I'm trying to get out my car with my kids.
Okay, there you go. All right. Give me 1 second. Here we go. Oops, why did it do that? So here we go for today. Talking about infants first. Now, infants are that age group that grows so quickly. Can you imagine you're born at 7 pounds and you can't lift your head? And you're 1 year old and you're 21 pounds and now you are walking. So what a difference. It's the biggest year of your life. So it's the most dramatic. Remember that nutrition is the most important thing that we need to provide our infants at birth and through this first year. They need that nutrition in order to grow the way that they do. So they gain 5 to 7 ounces per week. They double their weight by 6 months. Remember that. Triple their weight by 1 year. Remember that. If we have an infant who's 6 months old, born at 7 pounds, is only 9 pounds, they're having a failure to thrive. They're not getting nutrition. And you're going to see that in their levels of cognition, fine and gross motor development. They're not going to be up to where they should because they need nutrition in order to get there. And you'll see them get a little bit heavier, and then they'll get taller and heavier and taller. I call it the stair step of her. So heavy, and then they get a little bit taller and heavy. So you'll see a baby grow like that. You got the handout that I sent you last week with the recording on the vital signs. And you saw that infants have a heart rate of 140 to 160 and a respiratory rate of 40 to 60. As we get older, those numbers are going to go down and down until we get to those adult levels. You know, an adult 60 to 90, 60 to 100, and usually your respiratory rate 12 to 20. That's normal. So it starts to come down and get better and more effective as the baby grows. Now, one concept we really don't think about is the baby's blood and the baby's immune system. At birth, mom gives the baby the best of what she is. She gives them the hemoglobin, hematocrit, and the anemia, the hemoglobin and iron, you know, that they need for growth. It also gives them the immune system. Well, this hemoglobin hematocrit is going to start decreasing because cells die. And infants do not start reproducing their own cells to after like 5 or 6 months. So it is normal to see an infant at 6 months old with a hemoglobin hematocrit of 10 and 30. Normal, because they're not making cells yet. Then all of a sudden, the baby starts making cells, and you will start to see their numbers go back up where they should go. And we'll see actually the child get more and more active, be able to do more and more because of more iron, more oxygen, more energy with that, okay? Their head growth, we know that there are 2 soft spots or fontanelles. We have the anterior, posterior, and these are these openings where the brain sort of shines through. And you could feel these soft spots, and you could touch them. It's okay. You're not going to hurt them. You're just not going to bang on them, you know, or bang, you know, if they fall and hit that, it could cause maybe some bleeding in there. So to be careful. But if they're not closing by 6 to 8 weeks, so you have the posterior fontanelle, it's not closing. Why didn't it close? What's going on inside the brain? Is it hydrocephalus? Is it a tumor? Something's happening. So we need to investigate. And then, of course, the other one isn't closing either. Why? Or if they close too early, what are the repercussions from that? And what do we need to monitor for that? They're listening, and they're able to reach and get that perception of that depth perception starts to increase as they get older and older. No, initially they hear a little bit, but then they start to understand, oh, who's mommy's voice, daddy's voice. They're starting to hear those things. And as they get older, you're going to see that. Their central nervous system, which does so many things with the body. You know, the central nervous system is part of that head lifting up, that be able to turn over front to back, to be able to crawl, to creep, to walk. All is the central nervous system making that body work. And it also works with not only those gross motor skills, it works with those fine motor skills, that grasp, that voluntary grasp, that pincer grip, ability to build, you know, blocks of 2 by ages 1 is the most intense system during the first year of life, because it takes the nervous system to make a child be able to get up and go, or to use their fingers and that fine motor. Their immune system at birth is mom's, like I said. all dependent upon mom, and she gives it to them. Now, one of the things that you think of is you look at those immunizations and you see how many are given at 2, 4, and 6 months. And you're thinking, why are we given this many? Okay, why are we giving so many immunizations? Well, mom gives the baby some antibodies at birth, but again, they are not maturing and they're gonna go away. So we are immunizing that baby against those very difficult diseases so the baby doesn't get it. At birth, a baby cannot regulate their temperature. Well, first of all, extracellular fluid from the amniotic fluid, they've absorbed it, so they're puffy. That's why they lose 10% of their body weight. It's all that extracellular fluid, so they can't keep it warm. So what does that mean for us as nurses? Well, initially, the baby is born, the baby should be placed under a radiant heated warmer, something with a heat device, or wrapped in multiple blankets if you don't have that access, because they lose heat very, very quickly, and we don't want to do that. Their kidneys, they say that a newborn infant should be having 0.5 mLs per kilogram. And we know if they're not urinating, they're oliguric, and we need to look at why. And we'll look at other things. In infants, how do we see if a baby's dehydrated? Well, the first thing I look at is the fontanelle. Is it flat or is it depressed? If it's depressed, this baby's also dehydrated. But then I'd be checking the heart rate. What's the heart rate? And blood pressure, because those things are affected by dehydration also. At birth, a baby shouldn't have anything by mouth except breast milk or iron fortified formula, because everything else is not absorbed and it can't be used by the GI system. It's not mature enough yet. So if we're giving cereal, let's say for an infant with reflux, to want to thicken that formula or milk to keep it down, the cereal is just going to be in the stool, but we needed it, to keep the milk in the infant so the infant gets the nutrition. But you'll see very loose stools and you'll see the pieces of things in it. Here's some things that are fine motor development that when we think of infants, these are developmental levels that we'll be looking at. Being able to voluntarily grasp an object, that's about 2 to 3 months. Then we can put it in hand to hand at 7 months. That pincer grasp, which starts usually the hand, and then it goes to just the 2 fingers. Then taking things out of a container and building a block of 2. These are things that we will look at what an infant can do to really evaluate cognitive development. I gave you a blank one so you can go back and you can check yourself. So fine motor development is fingers, all about fingers, fine motor. What can I do with my fingers? Gross motor development is get up and go, anything to do with movement in an infant. So keeping their head up, rolling over from belly to back at 5 months, back to abdomen at 6 months. So just right there, if I know an infant can roll over completely at 6 months, I'm going to be careful if I have this infant on top of a couch, on top of a table, on top of a changing table, because they're going to roll off now. And I want to make sure that somebody is holding them or they're strapped into one of these things, because as a safety problem, that could be a problem. At 8 months, they're going to be sitting unsupported, no pillows. They can just sit there well. And then at 10 months, they can go from prone and they can get themselves up into a sitting position, which is pretty difficult for an infant. So nutrition, nutrition, nutrition. If you don't have proper nutrition, a child is not going to develop in the manner that the way that you want. So for the first 6 months, because of the GI system, it's only human milk or iron fortified formula. And there shouldn't be any other food. As I said, you'll see cereal with these reflux babies, but that's it. So breastfeeding is recommended for at least the first 6 months, and then we introduce foods, but you could continue breastfeeding up to 1 year. Many stop sooner, many stop later. Of course, it's a personal choice. And how do we know how much we should give this infant on each breast? Well, the book says 8 to 10 minutes, but we know if one breast is, looking soft and empty, we're going to switch to the other, depending on the minutes, doesn't really matter. As I said, at birth, they lose about 10% of their body weight. This is because of all that extracellular fluid they've absorbed just floating in this amniotic fluid. Now, when we look at an infant and we look at breastfeeding, many parents are concerned about, is the baby getting enough? I don't know if they're drinking enough. How do you tell? I can't measure. Well, the way you measure is if the baby's having 6 to 8 wet diapers a day. If the diapers are wet, the baby is getting enough food. You don't have to measure it. I mean, you'll see this a lot when you have those infants that were in the newborn ICU that had to have bottles, for their first whatever days, and the parents got used to looking at numbers. Now they're like, oh, but I don't know how much they're taking. Well, 6 to 8 wet diapers, they're good. These infants are going to gain, as I said, between 0.5 to 7 ounces a day. For the first 2 months of life, they gain weight really quickly. They just pack on the pounds, and all of a sudden they're getting pudgy and cuter and cuter. And we give breastfed babies vitamin D. This has to do with muscles and tendons development and bones, and we want them all to be strong. At that 6-month stage, we start introducing foods. What do we introduce first? It's all different. I am not going to tell you which one. Some physicians like cereals, some like vegetables. It's all a personal choice with the physician and with the parents. Now, the only thing with introducing, they should be introduced with a minimum of 3 days in between each single introduction, and only one at a time. Infants do have allergies to foods, and we would see that sometimes you get big rashes around the mouth. You could see diaper rashes, sometimes in the kinks of the arms or the backs of the knees, you'll see rashes forming. That's actually an allergy that it could be. So we introduce it slowly. Once they tolerate it, then we can introduce that and then say, okay, now let's introduce another something. But we don't, we go very, very slowly. And also at 1 year of age is when we switch the formula to whole milk. At that point, they don't need all of the calories in the formulas. And even say breast milk can be switched at 1 year old too. Dental health is important. But with infants, we will use either a little soft toothbrush or a wet washcloth, warm washcloth, and just rub the teeth off at bedtime. They should not have a bottle or anything to drink during the night, so that sugar, carbohydrates of any sort will sit there, because it does cause dental caries, big black looking teeth. And you have pictures later on that I can show you. Pacifiers at this point are good. I've seen them go good, bad in my career. Now they feel that pacifiers are something that helps soothe the child, that biting, chewing, sucking, they relieve stress. And pacifiers has been used in circumcisions, and it can help with procedures and decreasing that stress in there. And teeth, if they're getting them. Now, my grandson, my children didn't get teeth at 12 months old. They all got them 6 teeth at least about 15 months out. And it was all at once. It was not like 1 or 2, and then no, they poof all of a sudden. So I went through, dental nightmare, these poor children with all of these teeth coming in. But it's normal. We could feel them, but they weren't coming up yet. But usually they say that the formula is, if you are 8 months old, so that your age in months minus 6 equals how many teeth you should have. So if they're 10 months old, minus 6, there should be 4 teeth. But if they don't have it, it doesn't mean there's a problem. It just means all children are different. That's why I love children. Sleeping patterns, they sleep a lot. They should sleep, most of the night. But many of them will wake up, especially your breastfed baby. Those breastfed babies, usually at first, they'll be waking up every 2 to 3 hours. With formula babies, usually they'll go to 3 to 4 hours. And it's just, I think the thickness of the formula, I'm not sure, but that's exactly what I see all the time. They take multiple naps. And according to our book, walker swings and playpens are not necessary. And I'm sure all of us have used them or know somebody who has. So immunizations. Now, there's a lot. You've got a 2-page diagram in your book, which shows all of these immunizations. What you need to know about immunizations is the first immunization you give an infant is hepatitis B. And it's given in the hospital prior to discharge, or it's going to be at the doctor's office first visit. Why is it given either place? I don't know. It could be insurance. It just could be the hospital policy. Who knows? But hepatitis will be first. So that's at birth. Then at 2, 4, 6 months, we give multiple immunizations because we're trying to prevent this infant who's losing his immune system. It's not his, so it's going away slowly. We're building up his immune system against those diseases, which are really difficult to treat. And remember, we never give immunizations to an autoimmune person, even an infant who's been on steroids. That renders a patient immunosuppressed, okay? Now, one of the most difficult things I think working with an infant is colic. And colic is gas pain. And an infant cries and cries and cries, and their legs are just flexing, and you can see them grimacing, and their hands and they're clenched and they really hurt. If a mother calls, let's say you're working in a doctor's office or an urgent care, and a mother calls and says, my baby's been crying, and I don't know what to do. Is there anything over the counter I could give? Well, this is my response. If I have an infant crying that much, that infant must be seen by a physician, because there's not just colic that could be the problem. It could be something else. So that would be, as a nurse, what I would do. Another thing with infants, sometimes they're not getting enough nutrition due to many different reasons. And we call that failure to thrive. How would we know that they're having a failure to thrive? Well, if a baby was born at 7 pounds and it's 6 months old and we know the weight should have been doubled, right? Should be 14. What if his weight was 9 pounds? Something's going on. Why isn't this child getting enough nutrition? Well, of course, we're going to look at feeding and how much, etc. But it could be due to, reflux, losing through vomiting a lot of the feeds. Or it could be an allergy to food. Or it could be a metabolic problem that could cause them not absorbing the food. So these children will get a complete workup. Why isn't this nutrition working? And how can we give them what they need? Because without nutrition, cognitively, they're not going to be where they should be, because nutrition makes all of that work. Couple little special health problems that occurred to infants. Number one, your flat head, right? Back to sleep today. So every infant is sleeping on their back, and then laying on their back, so now they have flat back heads. Many parents, mothers are like, what can I do to straighten out that head? Well, you could put a helmet on like this little boy in the red shirt, and that can help do it and round it out, because the scalps of infant and all bones are very soft and they tend to mold easily. So we get older, they get brittle, and they're not going to mold like this. Infants are special. Well, what I would suggest is placing them on their belly during tummy time, and that helps that back of that head get back and rounder, and it does work, and the infant's head will be round. Another thing is dermatitis, diaper rash. So a baby all of a sudden gets a diaper rash. Well, why? Did the baby had a different food you just fed that child? Is it a new food? That can cause it. Or if the baby had diarrhea, of course, that could do it. That's an understandable one. But what if this is a new diaper that you put on them? They're allergic to it. It could happen. A new lotion, a new soap, a new anything can cause these things in infants. So we treat it, usually it's a yeast infection because it's nice and hot and moist in a diaper. Treat it with some nice statin powder or cream, and then have periods where we leave it open to air and let that, have some air to it. Also making sure we change this diaper much more frequently than normal. Another thing is cradle cap, or this white scaly scalp. Now, parents want it removed right away, and it's not going to happen that quick. So what we'll tell them is, put some mineral oil, you just wash it with soap and water, and then a soft brush gently, or a soft fine tooth comb very gently, and eventually it will go away. Sudden infant death syndrome, what are the risk factors? Well, it is gender specific. It's more males than females. Also, it could be due to smoke in the house, or that secondhand smoke. It also can be due to if you have just had the baby's just been sick, maybe a little cold, an upper respiratory infection, that also can be a pre-warning to SIDS also. And of course, co-sleeping or pillows and blankets over covered, all of those things can cause it too. An apparent life-threatening event is called an ALT-T. Most of the time, what I've seen with ALT-T is all of a sudden the baby chokes on formula or breast and holds their breath to the point where the baby turns blue. And then they have to turn the baby over and pat it on the back, and then the baby starts breathing, and then they run into the emergency room or the doctor's office. Oh my God, my baby turned blue. So the baby will be worked up for all different things. Why did this happen to the baby? Sometimes it could just be reflux. Sometimes they'll never know. But many times they'll send this baby home on this beautiful apnea monitor. And all it is a Velcro strap that goes around with two probes. It goes to a machine. You set the alarms for high and low respiratory rate and heart rate. And if it's higher or lower, you're going to hear this unbelievably loud screaming alarm that could wake up anybody. So that is your apnea monitor. I hope you have a chance to see one. So Letitia is a breastfed infant being seen in the clinic for her 6-month checkup. The mother tells the nurse that Letitia recently began to suck her thumb, which is the following is the best nursing intervention. Well, breastfed infant is sucking her thumb at 6 months. What do you tell her?
C, reassure the mother that the thumb sucking is normal.
What is that oral satisfaction on infants? They're relieving stress. They're comforting themselves. So it's absolutely normal. Yes, thank you so much. We're going to be going over theorists. So I did give you that handout. You should have it. I would have it printed out. I would review it before your first, second, third exam in essay, because you are going to see these questions. So get familiar with them. As an infant, it is what we call trust versus mistrust. So when we look at Erickson and we look at any of these theorists, it's not just know what those words are. What does that mean? So trust, what does a trust mean for an infant? Well, a trust is I cry and my needs are being met the way that I know will happen. I know that if I'm hungry, I'll be fed. My diaper is dirty, it's going to be changed. If I need to be burped, I'm going to be burped. So they know what's coming next. Mistrust is when an infant's needs aren't being met. That means they're in the room, they're crying, or they're in the corner somewhere, and nobody's paying attention to them. And not just one time, but a consistent not being met. And you'll see this baby, they're not going to cry at this point because they're tired of crying, because nobody ever comes over to them. So you actually can see this distancing that these infants do due to mistrust. Piaget is all about sensorial motor. What does that mean? Well, that's about sense, which means touch, feeling. What is this stuff? And then ori, mouth, everything in the mouth, and then moving it around and watching it go. So we start within the mouth, and then we start moving it around in the air, and then we are imitating sounds, noises, and we're playing by ourselves, putting this rattle in the air or the blanket or fingers, feet in the mouth. This is all part of being aware of around them. That's all using their cognition. It is where you have a rattle and, you know, all of a sudden they say, oh, I have a rattle in my hand, it makes noise. Okay, so that's the concept that they're understanding. Okay, and then that interpretation is, and I move my hand, I hear a noise. That's the interpretation. So they're not just taking the rattle, they also know it can do something. So this happens all within the first 8 months of life. Body image, they're getting more aware of themselves and more aware of their parts. And again, sucking their hands and their feet. If they have a chance to see themselves in the mirror, you'll see them with their mouths up against the mirror and touching it and being aware of who they are. Object permanence, you know, I talked about this last week. And object permanence is, even though a toy is hidden or not in sight, the infant knows that it's still there. You know, you could have a toy, let's say the baby's on the floor on tummy time, and that little toy is behind something else. You know, the infant, if he wants the toy, will try to scooch up to try to grab it. Well, nobody's there, knows how to do this all himself, knows that even though it's not in sight, I know it's, you know, here somewhere. It's like putting the kid's toy truck in the toy box at night. This is, let's say an infant or toddler knows that in the morning, he can go to that toy box and there it will be. Starting attachment and separation anxiety. They have their special people they want to be with. That's your attachment. It could be mom, dad, grandma, grandpa, caregiver, or whoever. Separation anxiety starts when you need to leave the kid somewhere, or you hand your baby to someone and walk away, and this child is screaming because they don't want to be away from you. That's that anxiety. Stranger fear is when you try to give, us as nurses, trying to take your infant, let's say just away the infant when they come to the doctor's office or to the urgent care, and we're trying to weigh in them. They don't want to be with you. They don't want to go to your arms, and they're turning around trying to cling on mom and dad. Now, as they get a little older with this stranger fear and they're back in mom's arms, they might peek and try to see who you are. And that's what that means. Their language, what does it start as? Well, what do babies know what to do? They cry, don't they? And they also can coo. Those are the things that start with, and then they go up and start imitating by playing as they get older and older. And there is a questionnaire that can be done regarding infants' temperament, just to let you know, we can determine what it is even as infants. And now I think the funnest group, the toddler, ages 1 to 3, 12 to 36 months. Your terrible twos. This is the age of temper tantrums, negativism. They want what they want when they want it, and no, 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 mine, 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 mine. I love the saying by Jerry Seinfeld, having a 2-year-old is like having a blender without a lid, because they can be anywhere at any time. They are all over the place. They are exploring underneath, around, over, in places you didn't know you could get to. So their weight is still going up, but again, it's slow. You know, toddlers are very, very slow, and their height is also slow. It's not as quick as an infant at all. It all slows down now. You know, they call toddlers a part of physiologic anorexia. They don't eat much now. They are very picky with their food, okay? They eat such little foods that you're afraid they're not getting enough nutrition. And one of the things that parents always tell a physician about. Again, they get heavier, taller, heavier, taller, and their head circumference now should be equal to or less than their chest. At birth, it was bigger. Their body systems are maturing, heart rate's coming down, blood pressure, respiratory rate coming down. And this is the age where they're always sick with a cough, a cold, runny nose, ear infections, tonsillitis, because at this age, this toddlers, everything is in the mouth. Everything is in the mouth. And I call it, especially if they're in daycare, they swap spit every day. And as good as a daycare is, it's still children touching children in the mouth, in the mouth. And, you know, it's actually, you would say, but they should do something. They need to, you know, prevent it. Well, actually, when you have a toddler who's getting sick, what is the body doing? It's building antibodies and the immune system. So by the time they get to school, they'll be healthier. So yes, toddlers are always getting into something. It's just part of who they are. I mean, and you think of these big adenoids, big tonsils, these little short eustachian tubes. This is why it's always getting these infections. They're also getting to the point where they can start holding their urine in their stool. So gross and fine motor development continues. They become more coordinated. That little clumsy little walk and little run of that 1-year-old by 2 is becoming more and more coordinated. They're becoming more able to throw with arms and hands, and, you know, becoming more accurate, becoming more refined as they get older. Visually, you know, their vision's getting a lot better and their depth perception is a lot better. Now, the thing with this is they know that if they're on top of the back of the couch and want to jump off over to the chair, you know, 3 feet away, they know how far going down is because they can see it now. But their body, their motor capability isn't able to protect them yet. They're not quick enough yet. So even though they could see that it's a long way, they can hurt themselves, you know, they can't protect themselves as well as an older child should. As I said, these toddlers, their hearing, smell, taste, touch is developing. And because of that taste and smell, they become more picky. They become children, many of them, chicken nuggets and macaroni and cheese. That's the 2 favorite foods. It could be. It's just they become picky because now they're tasting what they ate. If you've ever tasted baby food, you'd like, how do they eat it? It's because their taste buds are not like ours are. They're not as mature and they are using everything. They're looking, they're smelling, they're tasting everything in their mouth. They're seeing, they're exploring, again, their whole environment. So Erickson and Piaget on a toddler. So Erickson, you talk about autonomy versus shame and doubt, okay? When you're a toddler, this is a child who likes to do things that ego, super ego, they like to do things. They're pleasers. They like to please mommy and daddy, okay? So go put your shoes by the door, they like it, or your, you know, clothes in the laundry, they do it, they love it. But they are also sometimes held back by mommy. Please, you know, get down, don't jump there, you're going to hurt yourself. Well, if we allow them to do things, they're not going to be injurious, okay? I don't want, you know, from 15 feet up to jump, but a 3 foot into a chair, like a foot away, okay. Let them try because that's how they learn. And that's the shame and doubt. Autonomy, doing things for themselves, Shame and doubt is what parents hold them back from. We know that toddlers are the no people. But what keeps a toddler happy and relaxed and stress-free is a ritualization, which means what? Put them on a schedule. That means do the same thing all the time. They wake up, they have breakfast, they change their clothes, they watch TV, they go for a walk, they come back, they have lunch, take a nap, whatever that ritual is, keep it every day. They love that. That's why putting a toddler on vacation is hard, because you break that ritual and it confuses them. So they're not in control anymore. Now, Piaget is, again, sensory motor, touching, feeling, mouth, playing with it. You know, how do these things work for me? It is learning how to use what they know, and then taking that and building more information. And I'm going to show you some more as we go. As I said, Erickson is the parents are not allowed to do things. And then also they love to be able to do stuff by themselves. So it is autonomy, is able to do things for themselves. Shame and doubt is when the mom or dad or whoever don't allow them. So, you know, they don't feel like they can do something new because they couldn't or shouldn't or can't. Now, the sensor or motor stuff I'm talking about, those primary circular is what makes them happy cognitively. We know oral, that means finger in the mouth, suck it. And that is what? Decreasing stress. Secondary circular, I got a rattle. I shook it and now it's making a noise. And that's the response. And everybody go, wow, the baby's shaking the rattle. Tertiary circular reactions. Mommy goes to the kitchen to get something. The baby doesn't see it, takes a sippy cup, throws it on the floor. Because why? Mommy's going to come pick it up because you slammed it on the floor. So it is eliciting a response from the parents. So that is Piaget. Makes more sense now, doesn't it? Instead of just these words. Okay, toddlers, I mean all children, toddlers are now exploring their penis, their vagina, they're touching, they're looking at you, and the differences, okay? And at this point, if they're asking, you have a penis, I have a vagina, it's fine. They just know it as a word. They're starting to understand who is a boy, who's a girl, and what does each other do. In separation, they know that mom, who is mom, and who is the people they can trust. You know, they're starting to know that. They are becoming more of an individual. You know, they are a child, you know, for their self-soothing, you know, maybe it's not a finger, it's a teddy bear or a blankie. Things that help them, you know, be themselves. It could be that individual, this child always likes to wear, you know, a bow in the hair, different colors every day. Or maybe it's the child who, you know, there's all different things that make every toddler different. And you'll see these children going towards that. They're becoming more and more verbal. Now, I'm not saying you're understanding the words because they still have a difficulty in pronunciation, but they're talking more and they understand more than you really understand. They do. You tell them something clearly in a language that they can understand on their developmental level. When they're listening, you will get a lot of information to them. They really understand. They love to be independent. They want to feed themselves, spoon upside down, wrong way, fingers, food everywhere. But these, again, should be allowed. They're playing, they're trying to dress themselves. And remember, even if the clothes are on backwards or inside out, the attempt of dressing was there. And as a toddler, it should be praised. And the other thing is toddlers are starting to understand other people's feelings. I think this was evident when, you know, I had my knee, it was hurting me and I had ice on it. I have rheumatoid arthritis and it was pretty bad one morning and I had ice on it with my foot up. So, he wanted to sit on my lap, but I'm like, oh, be careful, my knee hurts. Well, all of a sudden, a little bit later, he comes around and he hugs my leg and my knee and kisses the ice pack and goes, all better. And this was a young 2-year-old child. They do have feelings for you. Again, play is so important. This starts with this social part of them, playing with each other's next to each other, sharing. All of these things are important. Toilet training, we know some children are ready earlier, some are later. When they're ready, they will let you know. We know boys and girls that all of a sudden have a new family member, another, baby, there could be rivalry there. So getting them participating is important. And temper tantrums. Toddlers love to throw themselves on the floor when they want something and you're not listening. I think the biggest time this has happened is in the middle of the grocery store. You're trying to get done with groceries, you let the kid down a little bit, and all of a sudden they're on the floor because whatever. So what do? Well, it is said to let them lay there, have a temper tantrum, and ignore them as long as they're not doing anything to harm themselves. Because when you respond to it, they're going to do it again because you responded to the temper tantrum. It's hard. It's hard not to go and try to pick them up, tell them to be quiet. But that's what the book says to do. Again, no, me do is part of it. And children who are under big stress, they will regress to try to decrease the stress. A 3-year-old, 4-year-old, a 3-year-old at this age, highest toddler, they might also start sucking their thumb again. And it's because something stressful is happening in their life. So here's some more questions, and you've got the answers here for you to look at them as you study this PowerPoint. So the toddler ages 1 should have at least a 1-word sentence, mommy, daddy, or milk, or go, or eat, something. By 2 years old, the child uses multi-words. So they're giving you these little sentences. Okay, they're starting to put sentences together, and they should be able to feed themselves, play by themselves, attempt dressing and undressing, even if it's not done properly. So the preschooler. This is age after they turn 3 to 4 to 5 years old. And this is when they now have to start sort of growing up. They are going to be put in preschool situations. They need to follow rules. They need to sit quietly. They need to cooperate with other children and listening to another adult. And this increased attention span is needed. And they need to remember what the teacher is doing. Their growth, again, is still slow, 4 or 5 pounds a year. You've heard this. Toddler, preschool, same thing. Height, the same. These children don't need the rituals as much as toddlers do. They have more flex. They can handle stress better. That's what that means. So they don't need the control of what's happening next, as long as you tell them what's going on. Gross motor, walking, running, climbing, jumping, hopping on 1 foot. They're not jumping rope yet. That's just way too much, but jumping up and down 1 foot is good. Fine motor. They have great eye to hand and muscle coordination. They can dress, they can draw on the lines, they can button a button, but tying a shoe, that's still too much. That's age 6. So Erickson's talking about feelings of guilt, anxiety, and fear, because they are afraid that their way of doing things is not what somebody wants. They want to, again, they're trying to please, they're trying to do things the right way. And if they don't do the right way, they've known it, and now they're feeling guilty because they're going to get punished. Like you know, let's say you open an umbrella in the house and the vase crashed to the floor and you didn't mean to do it. But it's an accident. It's an accident. It's an accident, right? It was, but they're afraid of the punishment. So it's knowing right and wrong, you know, and doing right as much as possible. This super ego, this conscience is all about trying to do right all the time. They're getting ready for school. We're going through those Piagets, which means now we're getting to the point of being aware of difference in people, colors of skin, different languages, you know, different points of views. Knowing, you know, this, you know, my friend Santiago said this, and my teacher said this, and understanding those things and supporting them. Their language is getting increased, and they are now understanding there's going to be something happened to you, whether you did things good or bad. There's going to be what we call the causality, which means there's going to be a result, a consequence. They do not understand time by the clock. They understand when you wake up from your nap in the afternoon, or after mommy picks you up, you know, from school, or, you know, when the morning time comes 2 times, whatever it is, they don't understand a clock. It's the event is what they understand, not the clock. And they're into this magical thinking. They're taking toys and they're making up stories and, you know, trucks flying in the air. I know my grandson is always making a video of himself so he can post it on YouTube, because he's a YouTube video nut. So he himself in his imagination is making a video. So I need to not talk to him because I'm going to mess that video up. Okay. Kohlberg talks about right and wrong, okay? But with right is a consequence, and with wrong, there's a consequence. So this is basically moral judgment. It has to do with right and wrong and a consequence. Sexuality, boys like moms and girls like dads. It's just what it is. They're starting to become more aware of their body parts, and they are going to not want you to be there when they undress to go to the shower or go to bathroom. Things like that's going to start happening. They're going to be dressing like mom or dad. They also are going to be exploring, you know, their genital areas. It's just part of it. And the thing with that is if they're doing it out in public, say, no, do that in a private place. That's not here. You know, you wouldn't make it a bad thing. It's not bad to explore yourself, but they need to do it in the proper place, you know, in their own room by themselves. They're going to be talking about sexual reproduction. And where do babies come? And then you need to ask them, what do they know before you start getting into it? As I said, that ritualization, that no, is really diminished. They don't need to be on a schedule as much. They're more flexible. This child can dress themselves, and they love to please. They love to make you happy, like to do things, you know, draw you a picture when you're sad and bring it in for you. And they do all the different lovely stuff. They're aware of the family and the culture. At this point, they know there's going to be Easter and there's going to be an Easter bunny, and they're going to go to church, and they understand Christmas, and there's going to be a Christmas tree and presents, and, you know, their manger is going to be put out, and they're starting to understand these things, which is the family, right? Family is the key of all these children. They're going to understand that, and they're going to start to try to bend that code of conduct. You know, bedtime is after you take shower, you're dressing your jammies, you've got 10 minutes, and then we're going to bed. Well, can I have 20 minutes? 20 minutes, please. Well, no, you're not going to cut that. You know, it's like trying to, you know, make it into what they want. Again, all the sorts of plays you're going to see. And again, there they are. These preschoolers are afraid of the dark, and they don't want to be alone. I couldn't leave my house, be outside with this child in the house, my grandson, because you'd hear him screaming for Nana Pop Pop. Where are you? He didn't like it. doesn't like dogs, just like this is saying. And he said there was ghosts. And we kept telling him, well, when you meet a ghost, could you let him come meet us? Because we'd like to introduce ourselves. So that was the way we dealt with that. They're afraid of something to do with their private parts, that something's going to happen. And they also are aware of what an object or people that associate with pain, which is, ooh, it's us nurses, it's doctors. That's who we know who's inflicted pain. So with sex education, you find out what do they know, ask them what do they want to know, and use those correct anatomical words and be honest. So I said masturbation and sexual and touching and feeling is absolutely normal. I mean, I've walked in on children rubbing against animals in the waiting room for me, and I would say, I need to go get something, I'll be right back. Don't bring attention to it. Let them do what they're doing, because it's not wrong. It's just an inappropriate place to be doing it at the time. So that's something that parents need to teach, because it's a private act, right? Now let's get to our Kahoots. That was a great way to end it, wasn't it? Any questions? Anybody want to win the Kahoot today? Sean, you're going to win?
I'll just be happy to get in the top 3.
Oh, there you go. How about you, Angel? You going to win? Dolores, come on. And Jeanette, yeah, you're smiling. There you go. We'll get you.
I'll be all right in the top 5.
Okay, I love it. I love it. Why not? All right, let me. Mhm. As I said, you will be out on time today. I always try to get you out about 15 minutes early because we don't have a break, and really that's your time. I try as much as I can, and we should be right about there today. I mean, I know some of you go right to another class. Maybe you'll have time to quick run, hit the ladies' room, get a glass of water, right? All right, let's get going. Week 2, infant, toddlers, and preschool, ages 0 to 5. It's a lot of information. What factor predisposes toddler to frequent infections like ear infections, tonsillitis, and upper respiratory infections? Well, we know it's everything in the mouth is one of the big things, but what is the other thing? Those big tonsils, adenoids, and the little tiny little straight eustachian tubes, and it creates all of those infections. What type of play is considered cooperative play? So I'm glad I have this question here. So when you're sharing toys with another child, that's associative or parallel play, okay? When you are cooperative play, it's children who get together, who do the same thing, and then there's an outcome. There is an end. Is it playing checkers? Somebody wins, right? It's a perfect example of it. or we're getting together ourselves and we're building a sandcastle together, but with the goal of the sandcastle. But the board games is a perfect one of that one, okay? So again, see how you need to refresh on play. According to Kohlberg's pre-conventional level of moral development, a preschooler who has moral reasoning what? What does Kohlberg say? So Kohlberg is there's good and there's bad behaviors, okay, or actions. And either one has a consequence. I mean, if you do something good, you are going to be praised with good consequence. If you do something bad, you're going to get punishment, that consequence, okay? So Kohlberg is exactly what you need to remember. Good and bad, and they both have consequences. Good consequence and bad ones. Which nursing action is appropriate to teach a preschool age child about a scheduled procedure? You know, you're talking about children and having them doing things, and you think about children, you know, there's children that are not going to sit. They're going to walk out the room and run. And I've seen it. So if we are going to have a child scheduled for a procedure and we have the ability, have a doll there to explain the procedure, of course, always on developmental level, make that rapport, have the doll, have equipment, let them touch, let them feel, and they're not going to be afraid when they get to that procedure. And it's not going to be a big deal to the child or the parents. Multi-select. What are some findings from a pediatric physical assessment? What is a physical assessment? So you talk about physical, it's stuff you can see, hear, touch, all right? Symptoms and history is all what? It's the history and physical. So physical is the growth, and then looking at the lungs and the abdomen and pulses and body systems, okay? So make sure you read questions to understand what they're looking for. Before performing a physical assessment on a toddler, the nurse should do what to cooperate, to look for cooperation. You know, a toddler, again, these are your 1 to 3-year-olds. And a physical assessment means you need to listen to the chest, the abdomen, you know, take vital signs. How you can get that done? And you're going to let them play, right? Play is fun. I mean, they paid me for how many years to go to work every day to play with children. It was great, you know, and let them touch that equipment so they're not afraid of it. I used to have them do blood pressures on me all the time. What would you suspect if you note that an infant's chin is quivering, the fists are clenched, and they're inconsolable or unconsolable? What does that look like to you? And I think the key word is unconsolable. You can't calm them down. And that is pain. That's probably a description of infant pain there. The only thing I didn't write was crying too. But that inconsolable, that is definitely pain. And that little chin is quivering. A multi-select. Erickson's infants, trust versus mistrust. What does trust mean? Trust versus mistrust. So trust versus mistrust. Trust is that infant's secure. They can predict what's coming, their needs are met. And this is an infant is a happier, calmer baby because all of their needs were met. Makes sense, doesn't it? Mistrust, opposite. They don't know anything and they get to the point where they're distant. A 3-year-old child is having an outpatient procedure. How would you help the child be less fearful? Now, I do many questions, several questions on this because this is an important concept when you are working with children. Probably the most important thing is to get them ready for these procedures. You know, in the long run, it's better for the child. And as a nurse, it will take you less time to get these things done. So give them a doll, let them know what's going on and what you're going to do, and let them touch the equipment and all of those things, okay? You need to do an assessment on an infant. You walk in the room, the infant's asleep in the mother's arms. What are you gonna do? You need to do an assessment on them. What are you gonna do? Baby's asleep. So baby's asleep and quiet. It is the best time to listen to those lungs and that heart because the baby isn't crying. So perfect time to do that. In fact, if I see an infant asleep in a mother's arm or in the bed and it's getting close to the time where I need to do another assessment, I'll do it then because you really can see what's going on with that infant. You can hear things so well. When do you switch formula to whole milk? Do we switch formula to whole milk? So at 1 year old is when we switch formula to whole milk. They don't need the extra calories from the formula. And now we're eating food, which should supply the other nutrients that the formula is given. Before assessing a 4-year-old child, what techniques would you use to approach this child? 4-year-old is a preschooler. And what are you going to do to approach this child? So I'm going to start with something like, oh, you got Batman on. He's really cool. Or look at those curls or those big blue eyes, or talk about something, get them calmed down. Then you can get closer and approach the child, and it will make everything you need to get done quicker in the long run. What technique can be used to examine a toddler? Ages 1 to 3, 12 months to 36 months. So again, play. Let them play. Let them, you know, teach them. Oh, let's see if there's a drum beating in your chest. Oh, I want to listen to my chest. Here's your chest. I'm telling you, it works. These children love it, and when they leave, they're happy. When assessing a healthy child's lymph nodes, what would you expect? When you just go in for your yearly visit, you're not sick. The doctor examined you. What should the doctor see with a child's lymph nodes who's absolutely healthy? And you shouldn't feel anything. They should be non-palpable. Only when a child is sick do you see them swollen, and you'll see those nodules, okay? Which Erickson stage of developmental levels would be used for a toddler? Remember, Erickson toddler talks about being able to do things by themselves and being held back by somebody they can't do things they'd like to try. So that's autonomy versus shame and doubt. Very good. Jessica's on fire. Multi-select. Erickson's autonomy versus shame and doubt is used to describe toddlers. What does this mean? So, playing by themselves is not what this is all about. It's about doing things for themselves, getting dressed by themselves, getting things for themselves, letting them try new things as long as it won't injure themselves. And the shame is about parents who don't allow parents to try new things that they could have, that wasn't things that could have caused harm. When walking into an exam room, you see a 2-year-old rubbing a stuffed animal on their pubic area. What do you do? 2-year-old, it's a toddler. So allow them continue. I forgot something. I'll be right back. Bring no attention to it, walk out, and that's the best way. If we start addressing every time they do these things, we're going to bring it, their mind's going to think it's wrong, and this could cause problems in the future for the child. You don't want to do that. A parent of an 18-month-old boy says that he says no, no, no to everything and has rapid mood swings. So has temper tantrums. What do you tell this parent? An 18-month-old, a toddler. No, no, no. And this is absolutely normal behavior for this toddler. It's all part of that blender with the lid off. They are explosive. What is descriptive of the preschooler's understanding of time? I still to this day, my 5-year-old grandson, I'm like, here, you can stay here for 3 morning times, which means 3 nights he can stay here. But he equates them to when he wakes up in the morning, it's morning time. It's what he told me he understood. It's time is associated to an event. A multi-select. How do you place a toddler on timeout? Now, I had my daughter-in-law here with a 1-year-old and a 3-year-old, my grandsons. And I think one of the days I counted 50 times, she went over what a timeout was and what the kid needed to do. And it's, you're going to be on timeout for 1 minute because you're 1-year-old. You're on timeout because you hit your brother. And I'm not starting the clock until you're quiet and stop crying and don't move. And I heard this 50 times for 50 different reasons. But that's the way they say you should do timeouts on toddlers. A 1-month-old infant's back of the head is flat. What are you going to tell the mother? I know my grandson had a flat head and my daughter was concerned. And today he's got a perfectly round head because we did what we told mommy. Put them on tummy time when they're awake and alert because their scalps are nice and soft and they do flex back really easy. Their bones aren't rigid like us older people. An infant crawls before they walk. This pattern of growth and development is called what? So they lift their head up, then they turn front to back, back to front. They can crawl, they can creep, they can walk. This is called what? As we grow and do more. And it's called sequential trends because it happens in a sequence. Okay, sequential trends. It happens in a sequence. How do you communicate with parents that don't speak a language you know? I mean, I've had parents walk in and they're Mandarin Chinese. They come with family. They come with, people they're visiting that speak perfect English. How am I going to communicate with these parents? What's the proper way? And you don't have family do it. And the reason why is they're going to interpret or, make their own understanding of what the parent's trying to say. But if you get this interpreter, you're getting an exact translation without that, underlying, their understanding put in there. So that little blue phone, pick it up. It's the best thing. What age would most children understand under, on top of, over, around, and back of, around? And don't think of your children. If you have children, think of what the book says. Because I know that if I'm thinking of my grandson, who's just 5, that's why I talk about him a lot. He was far ahead of this. They say the book is 4 years old. I know some of you have had children at 3 years old, 2 years old, almost 3 that could do these things. But the book is 4 years old. They understand the concept of under, around, over, under, and back up. Okay. So in pediatrics, forget you have children. This is what the book says. So in terms of language and cognitive development, a 4-year-old child should be expected to do what? Cognitive development means that they can think, right? And they can speak. So what do you think should be the answer? So they should be able to follow those simple commands, like go put your dish in the sink, put your dirty clothes in the laundry, put your shoes by the door. They should be able to do that. And they love to please, so they're going to do it. How would you assess the pain of a toddler? 12 to 36 months. And be careful. We know there's different pain scales, and we know that we can use anywhere from FLAC to FACES to numeric, and FLAC is it. Excellent, good job, because most students do pick the FACES scale. It's not quite there yet. Now, I'm not saying a 3-year-old cannot use a FACES scale, but according to the book and what's proper, you should use FLAC scale up to 36 months. Good job. A multi-select. What safety instructions would you teach the parents of a 6-month-old child? Like, think about what do 6-month-old childs need and do? Well, we know at 6 months, they double their age. At 6 months, we start introducing food one at a time, 3 to 5 days apart. They're still in a rear-facing car seat to age 2. They're starting to explore, so cover those electrical outlets. And because they're turning completely over at 6 months, don't lay them on the couch or the changing table unless they are secured properly. Good. A nurse receives a phone call about her 6-week-old baby. He's crying a lot, and the mom wants to know what she can do. Crying a lot every day. Unconsolable. So this is one of those things where that infant needs to go get checked, because it could be more than just maybe just colic. So they need to examine that infant to make sure there's no other problems. A multi-select. What should an infant be able to do at 9 months old? I'm trying to make you understand developmental stages and to think about it and not just think what today they can do, but all the other stuff too. And these Kahoots really give that to you. So they should be able to sit unsupported. That's why it's not the red one. Voluntary hold a rattle, absolutely. And they're gonna put it to the other hand too. Pull themselves up to their feet. And of course, at 6 months, they're rolling over. There you go. The first expected fine motor developmental milestone for an infant begins with what? What's the first thing they can do? Fine, fingers, fine motor, fingers. F for fingers, fine. So the first thing is that reflex palmar, okay? Put something in the hand and they'll close it. Second thing is voluntarily they grasp a rattle, okay? What statement about toilet training is correct? Actually, I just identified there's probably 2 things that could be here, but it's the one thing that sort of helps a child become potty trained. So number 1, they want to please the parent, the mom, the dad. But yes, bladder training is usually before bowel. So actually they're both correct. I'll be changing that. A toddler's parent asked the nurse for suggestions on dealing with temper tantrums. Remember I described this as laying down in the grocery store and screaming and yelling, kicking? So ignore the behavior, and as long as they're not going to hurt themselves, because if you are going to respond to the behavior, they got your attention, he got your attention. So they want your attention is what they really wanted. So try not to, and it's very hard, very hard. A 2-year-old has difficulties in activities, sensory sensitivity, has only spoke 1-word sentences. How are you going to assess this? So sensory sensitivity, usually infants, toddlers at this age, they're not having these difficulties. They're speaking more. They, there's no sensitivity. They're looking for things to look at. This is something that you might suspect a child with autism has. So there is a checklist out there today to help diagnose, to get them into which physician to help them with the autism, to get them into the therapies they need. It's the modified checklist for autism toddlers. Parents are concerned the 8-month-old child's not developing like their older child. What is normal for 8 months? At 8 months old, they should be able to sit alone unsupported. They pull themselves to a sitting position earlier than that, and then blocks in a container. That's about 11 months old. What fine motor skill is expected of a 4-year-old child? Then look at these, and what's fine motor? What do you know about fine motor, gross motor? So as you're looking at these questions, tear them apart. What am I looking for? What do you think? And the answers are able to button a shirt. They're not tying shoelaces to 5 or 6 years old. Skipping and walking are both gross motor because that's movement. That's get up and go. Buttoning your shirt is with fingers. Tying shoelaces with fingers. Fine motor. Multi-select. What gross motor skills should a 4-year-old be able to do? So fine motor is buttoning a shirt. 4-year-old gross motor, get up and go, is what? So we know that hopping on one foot, absolutely. And then walking upstairs using both feet going up there. Jumping rope is not till they're 6 years old. And tying his shoelaces is fine motor. You used your fingers. Car seats can safely switch to the forward-facing position at what age? So forward-facing at 2 years old. Now I had a quandary with this. My grandson, and I didn't understand, I've been out of car seats, for many years with my children. So my grandson, 2 years old, he weighed 22 pounds and he was 2 years old. And do we switch it or not? So the answer was, doesn't matter the weight, it was the age, because it's the muscle development and the ability to be able to tolerate, in case there's an accident. It's the muscle control they worried about, not the weight. So yes, at 2 years old, you can put them forward. The second expected fine motor developmental milestone for an infant begins with what? Well, what's the first? What's the second? And what are you looking for? F for fingers, fine motor, not gross, get up and go motor. Fine motor, fingers. So the first thing is reflex. The second is voluntary. They grab that rattle by themselves. And then the pincer is after that. An RN doing a developmental screening on a 10-month-old should expect which fine motor skills from this infant? 10-month-old, what can they do? Fine motor. Fingers, what can they do? So the red one, the 2-block towers at 12 months old. The blue one, putting objects in containers, 11 months old. And then placing objects in containers again, that's 11 months old. So the only thing that's left is grasping that rattle and using that pincer grasp. Frequent developmental assessments are important for which reason? Like, why do we do this? Why do we have to understand this? Why do we look for these things, in our children if we work pediatrics? Because we want to know if there's a problem. Children are the most resilient of all humans. You start early intervention, giving them those things that they need, they can catch up so quickly. So the quicker we catch these delays or deficit, the quicker we can bring this child back up to where they need to be with early intervention. Multi-select. An infant searches for her toy. It's not in sight. What is that called? She knows it's there. Where'd it go? So it's, being by themselves and starting to play by themselves without a parent. It's memory development, knowing that she saw the toy, it must be there somewhere, but the name of it is called object permanence. The natural physical developmental sequence that most children follow is what? What do they do first? So the head is the first thing that you see. Lift their head, roll over, creep, crawl, cruise, and then they're going to walk. I'll multi-select, which would alert the nurse to hold the digoxin on an infant she's caring for. Now, digoxin is a real medicine that infants do take, and small little infants do take it. And they can't tell you what an adult could, right? They can't tell you they're nauseous or seeing visual disturbances in yellow. What, as a nurse, are you going to be looking for that infant? You're going to look at the heart rate. It has to be, well, infant 140 to 160, it's 90, that's significant. Of course, dig level, potassium level, absolutely. Pulses have nothing to do with it. Another thing that might make me hold a digoxin and wait for a digoxin level is if the infant was vomiting and usually are not a vomiting type baby, because it could be vomiting and nausea is a sign of toxicity in the adult, right? So it transfers to the infant. So it might just be vomiting, and I will check it first. In general, an infant should triple their birth weight at months of age. Doubles at 6 months, triples at 12 months. Need to know these things that I'm showing you. When an infant's toes spread when the soles of the feet are stroked, this is called what? And that's just like adults, it's called a Babinski, and it's really testing their central nervous system. Rooting is when you just stroke that little cheek and they try to get a breast or a bottle. The startle reflex or Moro reflex is when they hear a loud noise or maybe their crib is hit and they jump, their hands play and their legs come up. And grasping, we've talked about it, about fine motor, voluntary, involuntary. When entering an infant's room, the door slams shut and the infant jerks and starts to cry. What is this reflex? And that's called Moro or startle. And is the normal reflex? Yeah, but the name of the reflex is Moro or startle. A 4-year-old's reluctant to take the medicine. What intervention should the nurse take? Not uncommon for a 4-year-old. So they say to do a straightforward approach. Now, in pediatrics, we don't mix food and medicine with food or juice or in a bottle. What if the infant doesn't take all the food or take all of the juice? How much did they take? You know, how much didn't they take? You don't know the dose, and you're not getting all of the dose in. So how would I do this to a 4-year-old? Well, you have medicine to take. Would you like a pill or would you like liquid? Do you like it in a syringe or a cup? And that would be it. And come in with it and say, here, now you can take it. Okay, give them some choices and then straightforward. It is actually the best way to do it with children. Now, if it's a tiny little piece of something in food, that's one thing, but putting it in a bottle or a lot of food, absolutely not, because you don't know what they took if they don't take it. Which intervention helps a hospitalized toddler feel a sense of control? What did I tell you about toddlers and how they feel good, their sense of control? What do they need? And that's following their usual routines. They like that schedule all the time, and they do feel in control. Assessing a 2.5-year-old toddler, what findings should you report to the provider? So if you're reporting something, that means something doesn't look right. So if the head is bigger than the chest at 2.5 years old, it's not right. The head should be equal or less than at this point. So we need to report it so that they can investigate what's going on. A multi-select. What are the risk factors for SIDS? So males are more than females, so gender. A recent viral infection, absolutely. And then of course, exposure to secondhand smoke. Breastfeeding actually helps decrease the risk of SIDS. What does the rooting reflex enable the infant to do? So rooting, you stroke that little cheek, and that little face comes around and wants to suck on a nipple or a bottle. Good job. Multi-select. A child's been admitted with profuse diarrhea for 2 days. What would you expect? So what you're going to see is hypokalemia, and you're also going to see some metabolic alkalosis. When you are doing your acid and base, especially through your med surge, know that the HESI has been focusing on some of these acid-base questions. So try to understand what you can. I saw 3 questions that I believe were acid-based. So you will be seeing them on your HESI, okay?
I thought diarrhea led to acidosis.
It does. It does. You're absolutely right. An infant is unable to take a breast or bottle for feeding. What's important to remember? So you have an infant who can't eat because of whatever medical reason. What should you do for this infant's growth and development? So we're going to give them a pacifier because we want to promote that sucking and that self-soothing. Sean, regarding your answer, you're absolutely right. I need to change the answer because when you have diarrhea, you're getting rid of a lot of alkaline because all of the enzymes that digest food are more alkaline, you get rid of it. So yes, your body becomes more metabolic acidosis. You are correct, and I will be changing that in the thing. When you vomit, you're getting rid of acid, so you become metabolic alkalotic. You're absolutely correct. I had checked that thing wrong. So thank you. Appreciate that.
Thank you.
Well, thank you. What does an infant start to do at 3 months old? Again, they're starting to roll front to back to front. Some of them, do it earlier. So be very careful. These are very mobile children at this point. Strap them in. And last question. An infant's first form of communication is what? And the crying, we know that starts at birth. They cry immediately, right? And then, of course, that little cooing that they do. So let's see if you got your wishes and who came in what. Number 3, Erica, good job. Number 2, Amira. Number 1, Jessica, good job, Jessica. And then Angel and Kiara, good job tonight. What I'd like you to do, please sign your attestations. I know that over the weekend I had to contact some of you and the response was quick. I totally appreciate that. Thank you so much. So sign your attestations and I will be getting this to you by tomorrow about 12 o'clock, okay? So you'll have your recordings and I'll be changing that Kahoot before you get the new one, okay? So that you do have the proper answers. So thank you, Sean, for reminding me. It's one of the things I have to do. And there's a couple spellings that I need to change. So thank you so much. Any questions, anybody?
I have a question for you after class.
Okay, not a problem. Anybody else?
Is there a schedule for like an exam review coming up, or do y'all do exam reviews?
Yes, okay. Exam review. You'll be getting your exam study guide PowerPoint Friday, tomorrow. You'll be getting that. And you will be getting the review of who does what. I believe I'm going to do Wednesday night at 5:30. That'll be the first one. They'll be, and they're recorded. You get all of these things. They're all going to be given to you. I believe the next one is going to be either Thursday or Friday, and then same time, and then somewhere Saturday afternoon. I still have to arrange that schedule with my group. I just had, my brother died 2 days ago. So I'm a little in the head. So I haven't gotten it done, but you usually would have had it by now. So you do have the PowerPoint. It is ready, it's updated. This PowerPoint not only gives you information for your exam, it also, I would use it to prepare for your HESI because it gives you all of those key concepts. So do the study guide, you know, do the Kahoots, look at them, see what concepts are covered, you know, and then go back to your book of those things you don't understand, okay? And you'll be good. Anything else I can help you with? Thank you for asking me, Maria. I forgot. Well, thank you, everybody.